Okay, so what we're going to do now is we're going to listen sort of dynamically to the movements and take a look at the movements here. You're going to get a sense of the movements of this joint and bone, and we want to have a clear sense of that. We want to think globally, so to speak, so don't lock your vision down on the TMJ. You're looking at the video, hopefully, while you're practicing this, but don't lose sight of the entire person. Otherwise, you're going to clamp your intention down and start to create movement just by your intention. So be aware of the joint, be aware of the motions, be aware of where your hands are supposed to be, but please don't lose sense of the global aspect of who you're holding. This is an entire being, not just a TMJ person. Wait for a softening or release or heat. Once that occurs, if it does, it may not occur the first time or maybe even the second time if this is new to you. Okay, if you do feel something start to change, the heat, the softening, everything that you felt before in your studies, then wait for that balancing aspect, that balancing phase where everything starts to come back into the midline and you're aware of some changes in the TMJs, in the jaw, in the sense of how it's relating to the midline. Was the jaw moving down and out to the left, down and out to the right? Was it not moving up? The circle is good for that as an imagery, but it's just what I use. You don't have to do that, but pay attention, and once you feel changes, obvious changes, then wait for it to reorganize around the midline, which is a technique we use throughout this system of craniosacral therapy. Okay, so if you get that softening, the release in the joint area, with your mind, you can start to disengage. In other words, there's a softening now, there's heat now, you know there's some change in this area. You can do a downward inferior movement with your mind, taking that TMJ, taking the mandible down out of the joint and slightly anterior. It's almost like about a 30-degree motion. But don't get lost on the angles. Just think down and slightly up and anterior. So the mandible is going to be heading toward the feet, caught it, and then slightly up toward the ceiling. And that's the disengagement move if you feel like it was necessary because it was jammed or there was some pattern in there of dysfunction that you're aware of, especially compared to one side or the other. And, just notice any changes in the sense of, spatially.